Hello, I am Shoo Lee, and I'm speaking about parents as caregivers in the NICU. Today we practice family-centered care in the Neonatal Intensive Care Unit. But in fact, family-centered care is still a situation where the care team in the hospital looks after the baby. That is, the baby is looked after by the nurse, the doctor, the therapist, and so on. And the family really are visitors rather than caregivers in the NICU. We try to arrange activities for the family's convenience, but they do not participate in the active care of the baby in any real way. And parents often feel overwhelmed, frustrated, and helpless in the NICU. Family integrated care is a change in paradigm of caregiving in the NICU, where parents become an integral part of the care team, and they are in fact the primary caregivers and partners with the nurses and the medical team. The nurse's job is no longer to look after the baby, but to be teachers and consultants to the parents. And in fact, the parents assume most of the care for the baby, including doing medical rounds, giving reports during rounds, providing all the care for the babies, and charting in the medical records as well. The only thing they do not do is procedures and IV. Now, through this process, parents gain confidence, knowledge, and control. Now, we conducted a multi-center cluster randomized controlled trial to test whether this model can actually work. And our hypothesis was that this kind of a care that we call FICARE, or Family Integrated Care, can improve weight gain and reduce parental stress compared to standard NICU care. Our trial was a multi-center cluster randomized controlled trial that was conducted on babies born at less than 33 weeks gestation at 26 tertiary level NICUs in Canada, Australia, and New Zealand. We included all babies less than 35 weeks gestational age and on low-level respiratory support or less. Babies who were excluded included those who are on palliative care, severe congenital anomalies unlikely to survive, critical illness unlikely to survive, parental requests for early transfer, and parental inability to participate for whatever reason. The primary outcomes were weight gain and parental stress and anxiety. The results of this trial showed significantly improved weight gain when the babies were looked after by their parents compared to traditional NICU care. There was also decreased parental stress and decreased parental anxiety and increased breast milk feeding. There were no significant differences in mortality or morbidity in the two groups. Our conclusion is that FICARE improves both the infant and parent outcomes. We are currently conducting long-term neurodevelopmental follow-up to determine if there are any differences in the long term. And further studies are required to examine the feasibility and safety of applying this model to other patient populations and different environments. We would like to consider that, in fact, this study suggests that we should bring families back into the care process rather than exclude them from the care process in the hospital. We need to empower families so that they can participate as primary caregivers in the NICU. And that we should treat the family as a single care unit rather than just consider that the baby only is our patient. Thank you.